So I'll be sharing with you a video of a patient who had a large hemangioma. And let me just start with my video directly. So is my video visible?
Yes. Yes.
Retinal capillary hemangiomas are developmental vascular tumors occurring either sporadically or in association with the familial cancer syndromes like von Hippel-Lindau. Smaller tumors can be treated with laser photocoagulation or cryotherapy. However, larger lesions can result in exudative macular changes or tractional retinal detachments. They can also have extensive membrane proliferations and can rarely result in a rhegmatogenous retinal detachment. A 45-year-old patient with a retinal capillary hemangioma developed a rhegmatogenous retinal detachment following a cryopexy done earlier. The visual acuity at time of presentation was a Snellen's equivalent of 20 by 200. The patient also had a macular hole at time of presentation.
Mudit, we are not able to hear.
Mudit is muted. Mudit?
Yeah. Can you hear it now?
Yeah.
Yes. Yes.
Okay, sorry. Yeah. So this patient had extensive membranes which we peeled, and then subsequently we tried to remove all the membranes from the periphery.
However, in view of extensive anterior membranes, a pars plana lensectomy was also done. The membrane removal over the angioma was then completed. PFCL was then used to flatten the retina. The feeder vessels were diathermized and endolaser was done along the edges of the vessels. The retina was then excised and the angioma was separated. A constant hemostasis was maintained using repeated diathermy and elevating the infusion pressure. The angioma was then excised and removed en bloc with the help of forceps after enlarging the sclerotomy site.
Why did you just chew it up with the vitrector?
Subsequently, a fluid air exchange was done and the ILM was stained with brilliant blue. ILM peeling was done for the macular hole. PFCL was re-injected and endolaser was done around the primary break and the retinotomy site. Subsequently, silicone oil was injected. Post-operatively, the patient's retina was attached and the macular hole was closed. The visual acuity had improved to 20/100. At 4 months, a silicone oil removal was done. The retina was attached and the hole had closed. The patient's visual acuity had now improved to 20/50 with an aphakic correction. Rhegmatogenous retinal detachments associated with retinal angiomas offer a unique challenge. However, in this case, a favorable outcome was achieved after a careful and extensive membrane dissection and an en-bloc resection and removal of the angioma.
I think I'll stop my share here. So this was a very difficult case initially because the angioma was so large. We initially thought that we will probably do a buckle to support it, but even that was not kind of working out. So then we removed all the membranes. And the problem with some of these angiomas are that there can be extensive membranes, not only over there, but even in periphery. And unless and until you remove these membranes, your retina will not settle. So like while somebody had asked if I tried to remove it with a cutter, I tried initially removing it with a vitrectomy cutter, but I could not. And that's when I decided to enlarge my sclerotomy and remove it en toto. And now we have a 3-year follow-up actually of this patient. And this patient is still maintaining a visual acuity of 20/50 with an aphakic correction.
Beautiful video, Mudit.
Absolutely.
Was it associated with the VHL or isolated hemangioma?
No, isolated, sir. This patient was
Okay, that is
investigated
what.
extensively.
I had one girl, repeatedly new hemangiomas were coming. Ultimately, I lost both eyes of the girl, that young lady. No.
So for this, Dr. Mahesh,
Yeah.
what is advised for preventing recurrent new lesions is to do a PRP. After removing it and after your surgery is over, you can do a good PRP and possibly avoid new lesions.
Okay.
Of course, I don't treat these things because I just refer to oncologists, but I mean, this is what...
very rare things.
I tried brolucizumab also in these patients with smaller lesions, but it doesn't seem to be working at all.
I had a question, Mudit. I have operated a few cases also like these. And as you said, it's 3 years follow-up and you don't see any recurrence of ERMs. 3 or 4 of my cases, they developed epiretinal membrane, 2 years, 3 years down the line, even after oil removal. So we've had to do a re-surgery. So what is your experience on recurrent ERMs in these cases?
So exactly, sir. So maybe I was fortunate in this case because I had done an extensive membrane removal, also done an ILM peeling. Probably that saved me over here. But we also have had patients who have had a recurrence, hemangiomas and also VPRTs. Both of these lesions are notorious for coming back with membranes. In fact, there's a patient of mine in whom I've done now 4 surgeries. Every 6 months, 1 year later, comes back with a membrane. And his visual acuity improves. The reason I'm operating again and again is because his visual acuity still is 6 times.
That's right.
But he comes back with a membrane every 6 months or a year later. So I have till now removed his membranes 4 times. But in this case, maybe because I did an ILM peeling. So in the last case also, I did an ILM peeling now. But even then, now he has got a peripapillary membrane again, which is coming over here. So somehow these VPRTs and hemangiomas do keep on coming back with the membranes. This one was probably lucky that even now, after 3 years, he doesn't have a significant membrane formation over there. Just the inferior areas where we had removed the hemangioma, that is fibrous. But apart from that, he's doing fine.
Do you think long-term systemic methotrexate might decrease the incidence of recurrent formation, since methotrexate is currently being evaluated as a treatment for PVR?
Yeah.
So just a thought, if you give a long-term systemic methotrexate, maybe 20 milligram like we use in uveitis, maybe it might reduce the incidence of recurrence.
Possible, sir. Good idea, but I mean, no personal experience till now with that. But definitely a biologically plausible idea.
Or even long-term steroids, maybe.
Steroids, yeah. Absolutely.
Yeah. Any other thoughts from any of our panelists or any of our speakers on this?
Yeah, I have seen these VPTs, they behave very badly. And I had referred one case to you, Mudit, and she was doing very well subsequently. Very bad. So they are, I mean, they are really bad lesions and you end up with neovascular glaucoma if you don't treat fast.
Yes.
All right. Thank you so much for all your